I am Dr. Louise Oliver, GP, therapeutic life coach and Buteyko breathing instructor. Breathing is the first thing we do as we enter the world and the last thing we do as we leave the world. On average, we complete 25,000 breath cycles a day, and we can only survive a few minutes without air. As this is such an important function of the body, how much time and attention do you spend on your breathing? Have you been taught the most efficient way to breathe that brings balance to body and mind? Breathing is an automatic function that does not require conscious control. For various reasons, over time, an increasing number of people have lost the ability to breathe properly. Breathing regulates our circulation, hormones, digestion, movement, sleep, and the nervous system. Therefore, poor breathing habits contribute to poor physical and mental health. Breathing is an automatic process that, when effective, promotes health and well-being. Effective breathing at rest should be through the nose, regular, quiet, slow, driven by the diaphragm, and almost undetectable. If your breathing is not like this, it is likely you have dysfunctional or ineffective breathing. However, your body can be trained to breathe effectively again. It's never too late to retrain your body to breathe efficiently and effectively. The results can be life-changing and include improved oxygen delivery, opening of the airways in the lungs, reduced breathlessness, reduced blood pressure, calmer state of mind, reduced effort involved during movement, and improvements in sleep, focus, concentration and energy. Breathing should occur through the nose, not the mouth. The mouth serves no purpose in breathing. Our nose is designed to warm, pressurise, moisten and filter the air we breathe. Using your nose to breathe is using nature's filter to remove pollutants, allergens, viruses and bacteria from the air we inhale. If you use your mouth to breathe, these particles go straight into your lungs with cold, unpressurised, dry air that can trigger coughing and wheezing. It is important to use your nose to breathe. We produce 6 times as much nitric oxide when we breathe through the nose rather than mouth breathing. Nitric oxide in the air is a noxious chemical, but in the body it is extraordinarily beneficial and was named the Molecule of the Year in 1992. Nitric oxide opens up the airways and blood vessels. It also promotes movement of the fine hairs in our lungs and activates mucus production to increase the removal of dust and any other particles in our lungs. Also, nitric oxide has antimicrobial effects against a range of viruses, bacteria, and infections. If you do not use your nose to breathe, you are likely to experience nasal congestion, as the nose is a use it or lose it organ. The good news is that if you switch back to nasal breathing, your nose will open up again. Consider if you mouth breathe at night. If your breathing is noisy at night, you snore, or you wake with a dry mouth, it is probable you are mouth breathing, which can reduce the quality of your sleep. By switching to nasal breathing during the day and night, your sleep quality can improve. We need to slow down the rate of breathing and make it as gentle as possible. A lot of people believe they need to take big breaths to take more oxygen into the body. However, we have more than enough oxygen going into our lungs. The human body actually carries a surplus of oxygen in the blood. And this is apparent from the fact that 75% of oxygen we take in is exhaled during rest. Even during physical exercise, when the muscles need a much greater supply of oxygen, as much as 25% of the inhaled oxygen is exhaled. Oxygen is only able to enter the blood in the small air sacs at the end of the airways. Air exchange cannot take place higher in the airways. If we breathe fast, we are moving air in and out so quickly, we reduce the amount of air exchange taking place in the small air sacs. The diaphragm is a muscle at the bottom of our lungs that some of us have forgotten how to use. This is especially true if you're experiencing anxiety, breathlessness, history of past trauma, chronic pain or ill health. The body can survive on shallow, fast breaths. However, this triggers the fight-flight system and fuels anxiety, breathlessness, chronic pain or ill health. If we breathe using the diaphragm, we help the heart to pump the blood around our body, and it turns on the body's relaxation response to produce a sense of calm. Breathing through your nose 24 hours a day, including when exercising and sleeping, makes it more likely you will use your diaphragm. It can seem confusing when first considering working on breathing, as there are various breathing techniques. The most efficient breathing rhythm for our lungs and heart at rest seems to be breathing in for around 5 to 6 seconds and breathing out for around 5 to 6 seconds. In other words, only breathing 5 to 6 breaths per minute. This may seem impossible to you at the moment, however, it is something to aim towards. The main message I want to get across is to allow your breathing to be through the nose 24 hours a day and be as gentle, slow and as low as possible. Breath holding is one of the most powerful methods to induce a sensation of breathlessness. The Buteyko method uses a control pause measurement to assess the severity of dysfunctional breathing and to monitor progress. The control pause measures the comfortable breath hold time. Ideally, the best time to take this is in the morning on an empty stomach. I will talk you through taking your control pause. Sit upright. Keep your mouth closed throughout the measurement. Take a small silent breath in through the nose, a small silent breath out through the nose. Hold your nose with your fingers to prevent air from entering the lungs, and count the number of seconds until you feel the first distinct desire to breathe in. So that you will feel that either as a contraction in your neck or contraction in your diaphragm. Your breathing should be calm afterwards because this is a comfortable breath hold. We are not testing willpower. For functional breathing, ideally we are looking for a control pause of 40 seconds. If your measurement is much lower than this, please be reassured for every increase in 5 seconds you will feel improvement. If you have a very low control pause, you would benefit from breathing re-education. I have noticed if I've eaten processed foods, experiencing stress, or had a lack of sleep, it has a negative impact on my breathing. My improved understanding of how my actions impact my breathing has encouraged me to make good lifestyle choices. Spending time each day on improving your breathing will over time train your body to breathe in an efficient breathing pattern unconsciously. You will then find your breathing pattern slows down, it uses the diaphragm and nose without you having to consciously think about it. If you are struggling to achieve this, please contact me for breathing re-education.